HIV/AIDS affects approximately 45 million people worldwide, and nowhere more so than sub-Saharan Africa, where the virus is most prevalent. South Africa, Africa's richest country, is home to the world's largest population living with HIV, a staggering 5.6 million people based on data in 2008. Making up 10% of the population, if all those people stood on a football pitch, they would fill up over 1,100 pitches. The same amount of people is equal to the entire population of Scotland, and 4 times the population of neighbouring Botswana. How does one fight such a harsh statistic and turn the despair into hope in a country dogged by myths and misinformation? Fighting this disease on a large scale in a full-scale team effort has never been done before, until now. Combining national healthcare, NGO planning and implementation, together with the aid of international funding, Broadreach Healthcare, in tandem with the Mpumalanga Department of Health, is taking the HIV/AIDS pandemic head on.
It's time that in public health we begin to tackle issues like HIV with interventions that are at the same magnitude as the disease burden that we have. In South Africa, we have a very generalized epidemic. In some pockets of the community, prevalence is well above 30%. And it actually would not be responsible to be conducting any type of program without understanding how that prevalence disaggregates itself across the community, understanding who's infected, who's not infected, where are they located, and therefore be able to plan rationally, and for the government and the system to be able to allocate resources rationally, you need this information at a fundamental level.
In response to this need for a different method of combating HIV and AIDS, the I Live campaign was launched with a view to testing an entire sub-district of a municipality for not only HIV, but also general well-being. The area earmarked for this pioneering initiative is the Mpumalanga municipality of remote Dipaleseng in the northeast of South Africa. With a population of approximately 45,000 split into 6 different areas, ranging from rural township terrain to small town landscape. Between the period of October 2009 to March 2010, a target of 15,000 people was set for testing. Those at most risk of contracting HIV were the main priority of the campaign, ensuring that those in most need were included. This was in essence individuals above the age of 15 who are sexually active. The community embraced the project, and members actively volunteered to mobilize the target population by donning green I Live t-shirts and spreading the initiative's core values and mission goals. In response, the target population met the program with enthusiasm, and interest grew as the campaign drew closer to launch day.
I live for my partner and my child.
I live for my dreams and goals.
I live for my family, for my friends, and the community of Siatemba as a whole.
I live for the future. I am the future.
The project was kicked off with a massive testing drive at Siatemba Stadium in one of the municipality's townships on the 10th of October 2009. It saw a full spectrum of the population for the initiative turn out and be encouraged to know and not be ashamed of their HIV status by undergoing a general health wellness assessment and VCT testing for HIV.
Asithuthukise senze ukuphila ezempilo zifinyelele kuwo wonke umuntu. Lezi ezikhona namhlanje lapha ezibhekelene nokuyihlola ezifeni.
Sifuna ukuthi sizocela wonke umuntu waseDipaleseng, ucela umakhelwane wakho, ubhuti wakho, umama, ubaba ukuthi asupporte le program. Ngoba le program izosiza sonke.
Firstly, you must start with your body. Take care of it before you can go out and take care of the rest of the community. It begins with me.
To change Balfour, we have to first start changing our lifestyle, live healthy, so that when we say we want to change Balfour, we know that we are healthy, then everything can be done simple.
By voicing out that we live, I live, it simply means that there is hope.
When it came to testing, there was a sense of not only necessity but pride in the individuals deciding to take charge of their lives and know their HIV status.
We're doing a pre-counseling for HIV test and also explaining the wellness for them. The wellness is the cholesterol, the glucose and the blood pressure that they are going to test. So we are explaining to them before they go for the test.
As part of the program, everyone who tested HIV positive was also verbally screened for TB and pregnancy, whilst HIV-negative individuals were verbally screened for high-risk sexual activity and were invited to retest in 3 months' time. Broadreach Healthcare Program Manager Mapule Khanye leads us through a dramatized version of events. Mapule tests positive, which leaves her with lots to consider. She will however receive the necessary counseling and support needed to assist her through this difficult time.
We find much more willingness than most people would probably have suspected. We find groups that people felt did not want to test are actually more willing to test because we actually engaged them for the first time. We put the power in their hands. We made it their program, and they come forward. In fact, they tell us how to get their own group tested. So I anticipate that this particular initiative will have learnings that will literally border on being revolutionary from a public health perspective. And I'm excited and looking forward, therefore, to the results of this exercise.
In the days following the campaign launch, the next step in the program takes place. The data and research gathered returns to private healthcare partner Kayelo Consulting for capturing and management of HIV-positive individuals.
Once it comes into the office, the team leader hands it over to the diagnostics manager in the office. That diagnostics manager does their own quality check on the data. At any point along this process, any errors are identified and are removed from the pack so that we can rectify them before they go into the system. Once it's in the back end and saved onto the server, the data is then cleaned and filtered, and once that data is clean, it is then uploaded into a database for the patient management area to access in order to manage, as well as for there to be a single source of data for reporting thereafter. Patient managers access the database. Those patients that need to be managed, their comprehensive picture will be built about them, including their screening tests, their demographic data, any follow-up pathology tests that we had to get from the laboratory, as well as their referral forms, and refer that patient proactively to the referring institution in Mpumalanga.
In a follow-up to a HIV screening some weeks ago, Mapule is called by Kennedy, a Kayelo Consulting employee.
Okay, sis Mapule, ukhuluma no Kennedy ngikufonela from kwaKayelo Consulting.
Yeah.
Kusho ukuthi unegciwane nje wena elisemzimbeni hayi ukuthi une-AIDS.
Cha sengiyezwa manje.
Okay, ama-sosha akho omzimba wena kusho ukuthi athi awu 177 kufanele aqale i-treatment. Wena uzoya-ke ngithi uthe ukhethe ukuthi ufuna ukuya eSiyathemba clinic.
Mapule is referred to Siyathemba Wellness Center, the clinic of her choice, where she registers and is admitted into a treatment literacy program to learn about how best to manage her condition and how ARV medication is best administered.
Namhlanje ngizonifundisa nge-treatment literacy education.
Ngiyabona manje ngendlela esesikhulume ngayo sachazelana ngakhona ukuthi ngempela ngiyophila. Ngiyabonga. Sengizimisele manje ukuqala imithi yami.
Following her treatment literacy, Mapule's general health is once again monitored. She then sees a doctor who analyzes her condition and prescribes her relevant treatment medication. At the same facility, Mapule can then visit a pharmacy and collect her prescription. Mapule's case is one of many who have learned to successfully manage their HIV condition, such as Motawane and Matsileng, who as a couple have effectively managed their HIV for over a decade.
It's hard to find out to positive. It was hard to accept, but re accept and do because really ra enka jalo ka mafama really enka jalo.
Being HIV doesn't mean hore it's end of the world. O phela nako e telele haholo if una ARV tsa hao o itshwara hantle o exercise o ja dijo tse bonolo. Ke tla rata ho bua ka ho encourage batho, guys, let's go and test for HIV, know your status, because tlamehile o se tsebe o tlo kgona ho phela ha lololo o phela bophelo bo right. If o phela lifestyle e seng right o kgona ho phela lifestyle e right.
Re ikemisitse ho bana le a bright future together and le bana ba rona.
Tata Kabelo ke a leboha ha o ile wa ba le support mo ho nna le ha ke qala ho na di ARV wa nkgotleletsa hore ke dinwe, ke a leboha haholo.
These initiatives, they could never be pulled off by a company like Broadreach alone. We've always subscribed to a philosophy that using what exists is the most important first step when you try to launch programs and implement them. And therefore, we always look to find effective partners such that together we can form a team that is big enough to tackle the problem at scale. This is another example of the way we're approaching this particular initiative of how we try and leverage what exists already. By partnering with a partner like Kaelo, who are a private sector company, who have established experience and capacity in doing testing, by partnering with government who have the facilities, the scale, the access to community health workers, access to the individuals who we need to get to, by partnering with the community who in themselves are a system, and by adding then our expertise, we have come up in essence with a team that could actually manage pulling off district-wide testing at scale. We're never going to succeed unless we start facing the problem squarely. And from my perspective, this is exactly why you need to test, in particular when you're stressed for your resources, in particular when you feel you do not have a rough budget. It's the time to go out and find out what exactly is the extent of what I'm dealing with.